The information in this video provides an overview of the 3 health plans offered by Newport News Public Schools and will get you started on the way to making a decision about which plan is right for you. NNPS offers 3 health plans through Optima Health. As mentioned in the Introduction to Benefits video, a full side-by-side comparison of each plan and the employee premium can be found in the Benefits Handbook. On a side note, Optima is a Centera product. Yes, the same as the hospital. Effective January 1st, 2024, they will be rebranding and the insurance will also be called Centera. The plans and management are the same, only the name is changing. Let's take a closer look at the plans themselves. All 3 plans have access to the Optima network of physicians, but it is important to investigate whether your physician participates with the individual plan before you make your selection. All 3 cover the same services. The differences are in how the cost share is split between the covered member and the insurance. All 3 plans cover preventative and routine care at 100%. This includes annual physicals and gender and age prescribed diagnostics like mammograms and colonoscopies. Finally, Optima is in partnership with the PHCS network. This is a national network. If you are out of town or out of state, you can see any doctor or receive care from any medical facility that participates in the PHCS and be considered in-network. The prescription coverage for the NNPS health plans is not provided by Optima. NNPS partnered with Elixir to provide pharmacy coverage. This is also the same for all 3 plans. The prescription coverage is on a 3-tiered plan. The 3 tiers are broken out into generic, brand name, and specialty with a different copay for each tier. The covered medications are all the same on all 3 plans. However, there is a $150 annual deductible for brand name and specialty drugs under the Vantage and POS plans. Our plan year is January to December. This means that deductibles must be met again beginning each January. Mail order prescription is also available for all 3 plans. Mail order provides 3 months' worth of maintenance prescriptions for the cost of 2. Even though Elixir is separate, when you receive your insurance card from Optima, it will include the Elixir logo and information. This means that you only need to keep up with 1 card for all your healthcare needs. Present your 1 insurance card whether you go to the doctor or pharmacy. Now, let's explore the individual plans. The Vantage 35 plan functions similar to an HMO. There is no annual deductible with this plan. This means there is no out-of-pocket amount you need to pay before the insurance begins covering medical services. Almost all services are covered with a copay. This means there is a pre-established rate for the medical service. This is the amount that you pay as a patient for that service. You know in advance exactly how much of the cost you're responsible for, and the insurance covers the rest. The out-of-pocket maximum for an employee-only plan is $4,750. That means if you need medical care, once you reach this amount for the year, everything else is covered at 100%. Basic medical copays and pharmacy copays for the Vantage plan are shown on this slide and in the Benefits Handbook. The POS 1000 plan has a $1,000 annual deductible for employee-only coverage and $2,000 for covering family members. This means that the insurance will begin paying for services after you have met or paid your out-of-pocket up to the amount of the annual deductible. This plan functions as a coinsurance plan. Coinsurance means that you pay a percentage of the cost of services and then the insurance pays the rest. The cost share is a 30-70 split. The covered employee pays 30% of the cost and the insurance pays 70%. Even though this is primarily a coinsurance plan, regular doctor's office visits are still covered with a copay as seen on this slide. This plan also has an out-of-pocket maximum of $4,750. The pharmacy copays are the same with this plan as they are with Advantage and can be seen on this slide. The Equity 3000 plan is what we refer to as a Consumer-Driven Health Plan, or CDHP, also known as a Qualified High Deductible Health Plan. With a CDHP, you have no copay or coinsurance. As with other plans, routine and preventative are covered at 100%, but you pay the full cost of other medical services until you meet your annual deductible. $3,000 for individual coverage and $6,000 if you are covering family members. This plan has a $4,000 out-of-pocket maximum for individual coverage. Before you discount this based on the deductible, consider that the other plans have a $4,750 out-of-pocket maximum for individual coverage. With the Equity plan, you're paying up front. It also has a much lower monthly premium than the other two plans. This plan can save you a lot of money when you take into account the premium cost. It also includes a health savings account to cover the deductible when you do have expenses. We will talk about that next. If you're enrolling in the CDHP, NNPS will deposit funds to your HSA account annually to help you get started. $500 for employee only, $1,000 for employee and spouse or any number of children, $1,500 when you have family coverage. Family coverage is needed to cover the combination of a spouse and any number of children. We also encourage you to make contributions to this account. Think of it as helping to insure yourself. The idea is to start with contributing the monthly premium savings that you will experience by enrolling in this plan instead of one of the other two. It's also a good idea to pay out of pocket for medical expenses if you can, and let this money accumulate. Why? You want to at least have enough to cover a deductible should you have a major medical expense. And this account is yours. Even if you leave NNPS, you have access to the funds in this account. Keep in mind, the funds in the HSA can only be used for medical expenses. However, at retirement age, that changes, and this money can be used for anything you choose. You may also be familiar with flexible spending accounts, which can also be used for medical expenses. So how are they different? This slide shows a comparison of the two. NNPS does offer an FSA. This benefit will be discussed in the video on voluntary supplemental benefits. Finally, choosing insurance coverage is a big decision, and we have covered a lot of information. Even so, this was a high-level overview. Please review the more detailed comparison in the Benefits Handbook, or reach out to a member of the benefits team if you need help understanding the plans in order to make the best decision for your needs.